to the medical scribe position, and hopefully this helps determine if you think it's the right role for you. To begin with, we'll describe what is a medical scribe and some of the general skills that come along with the job. So, medical scribes are healthcare professionals that are trained to document medical notes and patient history during physician encounters. They'll insist in improving workflow and focus on high-quality patient care. Some of the general skills would be a strong attention to detail, a fast typing speed, strong knowledge of medical terminology, and excellent interpersonal skills. Some of the general roles and tasks that you might do if you were a medical scribe. So first would be medical documentation. Accurately recording patient history, symptoms, and physical examination findings are all part of your day-to-day roles and tasks. Next is assisting healthcare providers. So you'll be working very closely with either a physician, a nurse, or a healthcare provider to document notes during any of their direct patient encounters. Next, you'll be updating patient charts with any diagnosis, treatment plans, and follow-up instructions that might be provided. You'll also be preparing the chart to ensure that their charts are organized and ready for the provider to review either before or after the visit. Lastly, there's data entry, where you'll be entering any lab results, imaging reports, and other relevant data into their medical record system. So the hourly wage ranges from $12 to $20, but this can be higher or lower and highly depends on the state that you're working for, along with the provider, clinic, or hospital that you might be located at. The schedule is very flexible depending on the clinic and hospital, since you are spending majority of your time working directly with the healthcare provider, sitting in on their visits. So most of the time is spent during active clinic visits, so your shifts should range from 4 to 8 hours, but again, charting, data entry can extend the duration of your shift. Now, how do you become a scribe? So to begin with, you check if you're eligible. So you must be 18 years old, have a high school diploma or GED, and an immunization record that matches with whichever location or clinic that you're applying for. This is something that you can take a look at after you're trained, but it's just something to keep in mind. Next is enroll in just a training program that lasts either between 1 to 3 months, and many of these trainings are either online or in person. The cost can range from being completely free to about $1.5K, and again, this is highly dependent on the program you're enrolling in, the state, the complexity level of difficulty. So just check what's available near you and seek what the best option is for you. Lastly would be an assessment. So this would just test your typing proficiency, since you're working in a job that typically does require a faster typing speed of recommended around 60 to 80 words per minute. You'd like a strong understanding of medical terminology, since you're sitting in on these visits with the provider and the patient, and having an understanding of the lingo and the terminology would really help you excel at your job. And lastly is basic EHR system training, so electronic health record. This is very dependent on the hospital you're working at, because they might have a different system, and this is something that you will get trained on typically on the job once you're hired. And lastly, it's time to find a job or find somewhere that will hire you. But now that you have prepared yourself with the trainings, you're improving in your understanding of medical terminology, you are a very strong candidate for a nearby clinic or hospital to hire you. Obtaining a certification is not necessary. There is no state certification for medical scribe for the most part. However, some more advanced roles may require a certification. And then you're free to apply to clinics, hospitals, and scribe service providers to get you matched with a position. Now, diving into some of the challenges and rewards that might accompany the job. To begin with, some challenges is this job does require a high attention to detail, because you are working so closely and actively during the patient interaction. It is a very high focused and can be fast-paced position. Next is adaptability. It requires you to learn pretty quickly, adjust to the medical provider's style of either terminology, patient interaction, but it is something that you can always get better at the more you do it. So looking at some of the more rewarding parts of the job, it gives you great valuable exposure to the medical field and clinical workflows. Since you're sitting in directly with these patient and physician interactions, you can really have a strong understanding of how the healthcare system works. Like I mentioned earlier, it's a direct experience with the patient care and healthcare documentation. You're working very closely with patient data, with numbers, test results, and you can develop a strong understanding of how to interpret these. Lastly, you'll develop strong interpersonal, multitasking, and time management skills on the job, since you're working not only around your schedule, but also the provider and the patients. Now we finished the bulk of the presentation, but if you have any other questions, we have summary sheets that give an overview of each clinical role, including EMT, medical scribe, medical assistant, and more. We also have a detailed sheet for each position with specific training programs and hospitals in each state of your interest. And lastly, if you have any further questions, feel free to email, DM, or reach out with anything else you might have. Good luck, and we hope you find what you love most. Thank you.